Well, welcome. Welcome to Gaia Family Medicine. I'm Dr. Shaanta Hanagud. I'm a medical doctor, and this is my new practice. I used to work for another place. We won't talk about it, but now I'm able to do what I want to do. And this is our Wednesday Wellness series, and so we're going to be talking about insomnia, which is important and very common topic for a lot of people, mostly because insomnia really affects people's health. So I always like fun quotes to begin the talk. So I'm going to read this one by Matthew Walker. He's a PhD. He wrote a book called Why We Sleep. Sleep is the single most effective thing we can do to reset our brain and body and health each day. So why do we care about insomnia? Well, we care because if we don't get enough sleep, we actually experience poor health. We experience immune dysfunction, we experience blood sugar problems, we experience weight gain, we experience increased risk for heart disease, and it's so common. 80% of adults experience one night of sleeplessness per week. That's a lot of people. 33% of adults sleep less than the recommended 7 hours of sleep. 31% of adults use a sleep medicine or something over the counter. And women are affected more than men with insomnia. And people who have insomnia, during the day, they are sleepy, it affects their work, it affects their learning, they get brain fog, they can have driving accidents. Over 16% of fatal car accidents involve drowsy driving.
Wow.
Yeah. If someone is awake for more than 24 hours, like when I was on call, the behavior and risk-taking behavior is actually similar to someone who is over the legal alcohol limit. Yeah. So don't make any decisions if you've been up all night. So I just answered my own question. So how many hours should we optimally sleep? So for adults, 7 or more, which if I don't get that 7.5, I know it. And interestingly, like the school age kids need a lot more. So kids age 6 to 12, 9 to 12 hours, and kids age 13 to 18, 8 to 10 hours, which is why those teens sleep all day. So there's different kinds of sleep problems. Insomnia is one of them. But you can also have obstructive sleep apnea. Do y'all know what that is? Yeah, so basically people, they stop breathing and their oxygen goes low and it wakes them up. So actually they never get into those deeper levels of sleep, which are restorative. And then you can have that other problem where people are, have hypersomnia, where they're so sleepy, like the narcolepsy people. And then, people are sort of voluntarily not getting enough sleep, on the phone, go to bed at 1, have to be up at 6 for work, then they have now labeled it called insufficient sleep syndrome. And then you have our circadian rhythm workers, people who do night shift, people who are on call, people who have jet lag because they're going, internationally. And then people also have the interesting stuff like people that talk in their sleep, walk in their sleep, have the restless limbs, people grind their teeth. So there's a lot of different things that can alter the sleep patterns. So in general, when people have at least 3 months of insomnia, that turns into a chronic insomnia problem, they can start having a lot of symptoms that affect them during the day. So general lack of energy, fatigue during the day, trouble with concentration, trouble with their memory, stuff with focus, they can be irritable, they can actually have increased pain, which is never good. So the circadian rhythm is very ingrained in our body, and our light disruptors that we have throughout our modern society really are affecting people's sleep. So how does the circadian rhythm work? We have something called the suprachiasmatic nucleus in our brain. And our retinas have nerves bundles that go to that we call it the master pacemaker, that creates our circadian rhythm. And so when we wake up, actually our eyelids are translucent. So if you have a shade that's lighter and you don't have the room darked out, your body will actually sense the light as the dawn is rising, the sun is rising, to actually wake us up. So that is one of the part of the circadian rhythm, is the light hitting the retina. So people that never go outside, they're affecting their circadian rhythm. And the other thing is that melatonin starts being secreted around 9 p.m. and that's our go to sleep hormone. It doesn't start until dark. So especially now in the summertime, that can actually be much more delayed than when it's in the wintertime. So it's gonna vary through our seasons as well. But how do we get sleepy? There's something called adenosine in our brain that actually, as it accumulates during the day, it makes us sleepy. So then we go to sleep at night. And then when we sleep, the adenosine gets washed away, and then the adenosine levels lower, and so we can have wakefulness. And that's part of the problem with people who have like narcolepsy, or like where they really just cannot wake up. They have too much adenosine in their brain. So there's 4 stages of sleep. So you have your REM sleep, which is when you've had enough really good sleep, and that's when you dream. And the dream state is very active in our brain, and actually our body is paralyzed so that we don't act our dreams.
Yeah, that's good.
It's a good thing. And then we have 3 stages of what we call non-REM sleep. So we have a lighter stage by theta waves. And then we have an N2, which is about 50% of our sleep. And that has better memory refreshment and motor skill enhancement. So if we don't get into those deeper levels, then we could be having trouble with our motor and our memory. And then that slow delta wave sleep that people talk about, that is really good for memory retention. So it really helps with our memory. So if we just don't get into those deeper levels of sleep, we don't get refreshed, we don't work properly, we don't remember things as well. So what kind of person are you? Do you guys, are you more like night owls or more like morning people?
Night owl. I mean, I used to be a night owl. I say I'm a morning person now, but I want to be a morning person.
Yeah.
Yeah.
Well, and it's really interesting. So morning people, they have a stronger cortisol awakening response. So that's what wakes us up, is our cortisol levels normally rise. And they also rise our adrenaline, and that's what wakes us up. So people who are morning people, they have more of that kind of drive. And then the night owls, because they aren't really regulating their sleep, and with the sleep-wake circadian rhythm, they can get more health problems, they find. So there can be more depression, anxiety, diabetes, cancer, heart disease, strokes for people that like really push the limit. So trying to get good sleep hygiene, which I'll talk about, can be really helpful to get people back on track. So there's a lot of things that we talked about as far as when people are not getting enough sleep, as far as medical problems. So some other ones are, as you would think with the whole memory thing we talked about, Alzheimer's and dementia can also become more likely for people that don't sleep enough. The immunity that we talked about, they find in the studies that it decreases a lot of our real nice natural immune cells, like our natural killer cells, our lymphocytes. And then for people who are really trying to be more active and, really work on their blood sugars, and, people if they're trying to get healthier, it can shoot them in the foot because their blood sugars go up and it makes it really hard to stay active. And there's a really interesting thing that happens when we're sleeping that actually, other toxins other than adenosine accumulate in your brain. And when you're sleeping, there's this nice rhythmic pulse. They call it the lymphatic system waste drainage pathway. So if we don't get enough sleep, and also if we're not quite aligned with our body, then this flow of the central, we call it the CSF, the cerebral spinal fluid, it bathes the brain. And if we don't get that to wash away and to wash away those waste, you can wake up with more brain fog. So that's actually one of the things that is actually kind of important. I don't know, do either of you guys see like a massage therapist or a chiropractor or anything?
I go to a massage therapist like once a month or so.
Yeah, so people would like, if their neck is not aligned, you can actually get problems with the vagus nerve, which is our sort of rest and digest relaxation nerve. It's like when we take those deep breathings through, those yoga breaths, stimulates the vagus nerve so that we can actually get into that sleep mode. And we actually know that people who have mental health issues, it becomes this vicious cycle because there's a neurotransmitter called serotonin. Do you guys know about like serotonin reuptake inhibitor? So that's what we use for depression. But serotonin actually makes melatonin. So a lot of people have depression, they're actually low in serotonin and they can't make enough melatonin. So it becomes, again, this vicious circle where they can't get enough sleep, restorative sleep to help with their mental health. Some people have adrenal dysfunction. So when we have too much stress going on, it can really tax our adrenal glands. And then we can also have where we're doing too much stimulants, like too much caffeine or too much exercise, like late in the day. Like sometimes when people are exercising super late, it can also affect their sleep because they get too much adrenaline in their body. And then other things in the body, because our greatest place where we make our serotonin is actually in our gut. And so if we have gut dysfunction, like leaky gut and those kinds of things, that can actually affect how much serotonin we make, which can affect how our melatonin is produced, which can create more insomnia. So, so looking at that can be really helpful. And then medications, lots of medications, prescription medications can make insomnia worse, as well as like cold medicines. Like some people will take like, Apoquel and sinus or something, like there's Sudafed in there that can make people have problems with their sleeping. And then, people are really relying, like staying at home too much and lack of stimulation, not going outside, like not getting those things to actually get the brain active, not getting enough aerobic activity, people just, sitting and playing games all day or whatever, like most people, a lot of people's jobs are just sitting around, if they just don't get enough activity and both mental and physical, then it can make just going to sleep very hard. So, and some other things that really are important for melatonin production, obviously darkness. So people have really bright lights on in their house and we can just stay up all night because we got lights. So, but if you have that nice sleep hygiene or that sleep routine, like they actually talk about lowering the lights to like less than 200 lux to help make sure that the body is able to have enough melatonin production. Have you guys heard of the MTHFR gene?
Gene mutations.
Gene mutations. So people who have MTHFR gene mutations, they don't methylate their B vitamins very well, and they can actually, you need that methylation for melatonin to happen. So some people just naturally have troubles with their sleeping because they have MTHFR deficiency. And then some people, they actually found that other stimulants like nicotine and caffeine and then weirdly fluoride can affect the pineal gland, which is also important. So I don't know, have you guys ever had to use sleep medicines at all?
I take magnesium.
Magnesium is nice.
But I don't take like any
nothing prescription. Yeah. So I mean, a lot of people have to take something so that they get to sleep because they got to get up and work. But what's kind of fascinating about the studies on prescription medications is that they can actually affect the immune system. So there's increased risk of people who are taking prescription or over-the-counter sleep meds for pneumonia, which is, I thought was super interesting. And it actually doesn't affect their daytime performance. Like they feel like they have to go to sleep so they can perform well, but it actually reduces and makes their daytime performance worse, almost worse than not sleeping. And especially if they go to sleep and they wait a couple hours, like, oh, I can't sleep, and then they have to take something, they might take it too late and not have the full 8 hours to get the medicine out of their system, and then they're sleep driving and on Ambien or whatever they're taking, and so it can be dangerous for the population too. So a lot of what I like to do when people have insomnia, is talk about how much they're using medications, and if they're having a holistic approach, we can actually figure out what's actually the root cause, and we can actually help people by giving them things that will help with the root cause, and then help them slowly transition off of prescription medications. Because you have to kind of address the root causes and give them some other options to kind of get those on board, and then help them transition off medications if that's their goal, which is definitely one of the more of a safe thing to do.
What would an example of that be? A root cause?
A root cause?
Yeah, what would an example be?
So like adrenal dysfunction. So if people's adrenals are too tired, and I'll go through here in a sec, like a lot of the natural stuff that we can use, like ashwagandha is a really great adrenal adaptogen. So that's like one thing that you can do to address that root cause. But yeah, there's lots of one, and I'll go through some of them. But we have a fun interactive thing,
Oh, yay.
which is a sleep quiz. And
Failed it epically.
Linda, there's some pens in the drawer right there.
Thank you.
And then we have some books right here if you guys want to have something to write on.
Thank you. Did I get 2 pages? Oh, I did. Okay.
Oh, there you
Oh, thank you.
go. So I'll just read them out loud for the recording as well, but you guys can fill them out. So this is called the Sated Questionnaire, and it has to do with quality of sleep. So the first question is satisfaction. Are you satisfied with your sleep? And the answers are rarely, never, sometimes, or always. The next one is alertness. Do you stay awake all day without dozing? Timing. Are you asleep or trying to sleep between 2 a.m. and 4 a.m.? Efficiency. Did you spend less than 30 minutes awake at night? This includes the time it takes to fall asleep and the awakenings from sleep. And duration. Do you sleep between 6 and 8 hours per day? And the scoring is 0 for rarely, never, 1 for sometimes, and 2 for always. So the higher the score is better sleep, and the lower the score is not so good sleep. Does anybody feel brave enough to share their sleep score?
I got a 7.
Yeah.
That's pretty good.
Not bad.
Not bad. So on the back, we'll talk about sleep hygiene, which is, of course, ways to really develop a sleep practice. So developing a consistent sleep routine can really help with avoiding those nights of insomnia. So one of the things is to prioritize aerobic activity. Exercising 30 to 60 minutes before sleeping should be avoided, but otherwise trying to get good activity can help us get better sleep. trying to get outside for 30 minutes a day so you get actually that bright light, the good sunshine hitting those retinas to tell us, hey, it's morning or it's daytime, it's time to be awake. And then also reducing or eliminating caffeine and alcohol, both of those can affect our sleep. Avoiding blue light on the computer or devices at night, so wearing those blue light glasses. And then there's apps, and some of the computers do it naturally to help warm the light of the computer or device. Try to avoid bright light at night, so there's light meters that you can download onto your phone and actually try to see how bright is your rooms that you're staying in when you're relaxing in the evening. Are they low enough to help that melatonin be produced naturally? And get a nice warm shower, bath before bed. And then, try to use the bedroom only for sleep and intimacy. A lot of people, depending on their spaces, they spend a lot more time in bed, and that can affect sleep hygiene. Try to keep the bed linens clean, because some people have like dust mites and stuff like that. They don't do it regularly, and they can have more allergy symptoms. Consider wearing an eye mask if there's like too much ambient light in the room. Keeping the bedroom cool. So if people are too hot, especially women who are menopausal, it can make them really, or perimenopausal, which happens, in the 40s. Some women can get really hot and feel uncomfortable. Using a fan can help people stay cool, and also have white noise, which can help with sleeping. And then some of the environmental toxins can affect, or they can be like endocrine disruptors, like really harsh fragrances, or carpet that's new, or paint that has high VOCs. Some of those can affect our body. And then people who do have bed partners, if the bed partner is having sleep issues, it's important to address those, because you can only wear earplugs for so long. But it can be a touchy situation, but important. So as far as root testing, there's a lot of functional medicine testing that I like to do. We can look at toxins, we can look at hormones, we can look at neurotransmitter testing, we can see how the gut's functioning. So there's lots of things that we can look at as far as these root causes that can really affect how people are sleeping, and give us clues into ways that can help with the sleep. So there's lots of different things that, because if the adrenals are overfiring, they can make it hard to sleep. So there's adrenal adaptogens, like we talked about, like ashwagandha. And then there's, affecting the gut. So there's lots of herbal things like berberine and garlic and oregano oil and beets can help with the gut. Digestive enzymes, blood sugar things. Actually, magnesium can help with blood sugar as well. And magnesium really helps with turning off adrenaline chemicals. So that's why magnesium works really well for helping with sleep. There's an interesting herb called gymnema that is like nature's GLP-1 that can help with blood sugar issues. And then things that also help with that lymphatic drainage, anti-inflammatories like turmeric can be really helpful for that inflammation, that glial cell washing. So there's lots of different types of sleep challenges. So, there's the sleep onset challenge. So people that are just having a really hard time going to sleep, that first part of getting to sleep. And there's several herbs that can be really helpful. Passion flower, valerian. There's a product that we use called valerian complex that can be really helpful. And then there's ones that help with sleep maintenance. So that's staying asleep. And some of those herbs are St. John's wort, skullcap. There's a product called Nivaton Forte that if that's really what is, you know, if someone can go to sleep but they just have trouble staying asleep, that could be really helpful. You know, have you guys heard that tired yet wired problem? So that gets into that adrenal problem, and so there's one called ashwagandha complex that we use that mixes ashwagandha, skullcap, St. John's wort, licorice, and Korean ginseng. And for people that have a lot of anxiety, kava can actually be really nice for that. We also have some homeopathics too. There's something called Fields of Flower that we like to use. There's a product called Copacalm that we like to use that has GABA and L-theanine. GABA kind of works on the neurotransmitters similar to like the benzos, but so it just helps people relax. And L-theanine also helps turn off those adrenaline chemicals. And pain, I mean, some people are in a lot of pain and that can affect their sleeping. So there's a product called Nervogesic that we like to use that has some California poppy, cordialis, Jamaican dogwood. So I put some of these in on at the bottom there, just as like, you know, if people are looking into just some basics. And actually we do have an online store too, which is pretty cool through Standard Process, and then also which people can get through on our website. And then, you know, last but not least, you know, for women who are perimenopausal and menopausal, a lot of times looking at the hormones and doing some hormone replacement therapy can be really helpful. So doing bioidentical hormones, estrogen and progesterone can really make a world of difference for some women. So,
Huge.
yeah, like progesterone is one of the main things. The estrogen helps with the hot flashes, but progesterone, the way it detoxes in our body, it goes to alpha pregnenolone, and it really helps with the sleep. So women who are going through perimenopause, like one of the first things I do is give them some progesterone, either cream or something oral, so that they can actually get some sleep. So, you know, there's lots of things that we do to sort of get to the root cause, because everybody's a little bit different. But these are just some of the sort of basic things that most people could use pretty safely. And then things that I do, so I do the functional medicine testing, but I also do something called nutrition response testing. Have y'all heard about that?
Sounds familiar, sorry.
So it's based on muscle testing, but it basically gets at the body's nervous system to figure out why the nervous system isn't acting properly. And that's really important with sleep. So we have our autonomic nervous system, and our autonomic nervous system is that sympathetic or that parasympathetic. So the sympathetic is that, you know, you're being chased by the tiger, that fight or flight response. And if that's stuck on and the parasympathetic can't get online, then the parasympathetic, which is our rest and digest nervous system, if we can't get that online, then people can't rest. So through nutrition response testing, we can actually look at, through something called a nervous system stress test, to see what the autonomic nervous system is actually doing. And we can find stressors in the body to help to figure out why is that person not sleeping. Like, are they having a problem with some food that they're eating? Do they have an immune challenge actually that's bothering their body? Do they have heavy metals or chemical overload, which in our toxic world is a lot of people. And unusually, like something that is kind of a less known thing is scars can actually affect our nervous system. So a lot of women have like C-section scars, or people have like, you know, big lacerations, you know, they can actually affect our nervous system if the scars aren't treated properly. So we use like the PEMP mat and cold laser and some other things to help with the scars healing. And then a lot of people who have had long COVID, you know, a lot of people, it can really affect their their nervous system because of, hey, welcome.
I'm catching the very end. I apologize.
No worries. We can talk more after we're done too. No worries. Good to see you.
Good to see you.
So the nutrition response testing can really help with figuring out what kind of remedies can be helpful for the person, because through muscle testing we can actually help and feel what the body is energetically needing as well. So it's a part of the whole process about how we need to figure out what's the root cause and what's best for the person, and it's all individualized. Everybody's issues are unique to themselves, and so looking at the whole person and looking at what ways the body needs to be supported is really what we do here. So that's a lot of what we know about insomnia and what we can do to help people here, especially if they want to do it more naturally. So does anybody have questions or anything that they wanted to have me discuss more? We can discuss more.
So the nutritional response test,
Yeah.
is that the muscle testing?
Mm-hmm. Yeah, and actually we offer demonstrations for it if people are interested in doing it. If there's some things, if there's some things that people are interested interested in addressing, we actually have like a little mini history form. Then we can figure out some things that could be stressors in your body and see if there's some remedies that could be fixing it, or if really insomnia is your main issue and you want me to just test and see if one of our products would help for insomnia. So it's fun. So if you guys want to do it, the demonstrations are free and fun. So yeah.
Cool.
Do you find that when I've had insomnia a lot of my life, pretty chronically, and when I would go see a doctor, all they wanted to do was put me on an antidepressant, right? When really we found out very later on that it was really a hormonal issue. Do you find that that's probably, there's a lot of people with hormonal issues versus they're not really depressed, but their hormones are really off?
Yeah, and it really depends. Is it the hormones that are off, or is it their guts that's off, so their body can't make enough serotonin and melatonin? So it's very complex, and the hormones, when they are off, if the adrenals are too high, the estrogen's too high, and they really need some dim, or their progesterone's too low, and they need to have some, progesterone support. I do a hormone test called Dutch, which is a dry urine test that women can take home, and we can actually see what's going on with their hormones, their melatonin, their cortisol waking response. We can actually see how their body detoxes their hormones and see if they're detoxing safely or not, which is why the DIM with calcium D-glucarate works really well. And also why we need methylation is to make sure that hormones detoxify safely.
A storm or motorcycle, an accident. I'm going down the list. Yeah.
Yeah, exactly.
Thankfully it sounded like thunder, which is such a common thing in
Yeah.
our evenings here in Atlanta.
Oh gosh, every evening.
I know, we're in a tropical zone now.
Yeah.
It's crazy.
I saw a rainbow, by the way, when I was walking in here.
Yeah, so it's definitely.
Oh,
That's
that's
some
great.
rains.
Okay.
Love it. So yeah, and that's where the individualization comes through, so that we can really figure out what the root cause is for people's issues, especially with insomnia, so they can get better sleep and get better health, and for the longevity too, so that people can really have good memory and good health through their healthy aging.
Is the hormone testing done just with the urine test, or do you also do a blood panel?
We do both. Yeah, so we can send stuff off through Quest to just get hormones. The Dutch panel is just, you can get these organic acids for the detoxification pathway. pathways, which are important because, especially if women are thinking about doing hormone replacement therapy, the estrogens can detoxify naturally into 3 ways, and there's 2 ways. The 4 pathway and the 16 pathway are kind of like we don't really like those pathways, so we have to have enough methylation support and enough of the DIM to get the pathways to go to the 2 pathway, which is the preferred safer pathway. So it's really cool to see how these processes are very individualized for people. And we can see for women who are perimenopausal, do they go on that alpha progesterone pathway? Will progesterone really be helpful for their sleeping? And you can actually get a melatonin score on there. You can actually look at the gut and gut dysbiosis. And weirdly, like a lot of people will use melatonin, and actually their melatonin levels are fine. That's not really the root cause. And so if you give more melatonin, it can get too high, and people can get severe headaches, really bad nightmares, So melatonin, it can be very nice if it's really needed, or if it's way too high, then it can really cause problems. So, those are some of the things that we can do to help figure that stuff out. Yeah, that's pretty cool.
I have a question. If this recording is going to be available for us to see, because my sister needs to be here. That's who needs to be here.
Actually, I want to post it on our YouTube channel. Yeah, so we do have a YouTube channel, so I'm going to get it.
My sister's out of town right now, so I probably would have invited her to this because she has terrible insomnia. It's like really bad, but
yeah, and it's we're going to be doing more videos for our YouTube channel. So
This is the beginning.
This is the beginning.
yay.
Yeah. Well, good. Well, I'm really glad y'all came, and we can turn the video